I'm here with Dr. Lewis Lovett, and I'm going to be interviewing him about a topic of healthcare, and more specifically, universal healthcare. Um, so, Doctor, what I wanted to ask you, what type of doctor are you?
Well, I'm a medical doctor, and I practice both internal and pulmonary medicine.
How long have you practiced medicine?
Approximately 30 years.
Have you, and what do you think about it? How have you gone about your practice? Do you see patients?
I see patients. I'm also involved in a graduate medical education program, so we train residents to become clinicians, eventually to go on to get their boards, receive their boards in internal medicine. I also teach students. So I supervise residents and students seeing patients in the continuity clinic, and then I see my own patients in my private clinic.
Now, do you believe, what do you personally think about the current healthcare system? Do you think it could be enforced? Anything about it could be changed?
Well, first of all, I feel that it's very flawed. It's a very flawed system. I think it's deficient in many ways. It depends, how you look at the healthcare system, but I believe that healthcare is a right, and therefore I believe that healthcare should be equal and provided to all. And so, as it stands now, we don't provide healthcare to all. That is one reason why I have been in academia pretty much all my professional life, because through graduate medical education, we increase access to care, we address healthcare disparities, and we provide care to populations of patients that otherwise would not get care.
Now, what do you think about, in continents like Europe, they have universal health care.
Mm-hmm.
Do you think universal health care could work here?
Well, as you know, I lived in Europe for 12 years. I went to school there, and I had the opportunity to see close up the healthcare, and it's a very beautiful thing. It actually works, and it provides very good care to all the citizens of the European nations, and I think that when you look at the rest of the world, pretty much all of the first world countries have a national healthcare system. It's not a system whereby it becomes a business. It's not for profit. Okay, it's a non-profit type of system, and therefore healthcare is equal and provided to all.
So would you say, being a medical professional, having practiced medicine for over 30 years, having lived abroad, studied abroad, gone to school abroad, witnessed it firsthand, that universal health care, at least in your opinion, is a much more effective way compared to the privatized system we have in this country?
Absolutely, and not only is it an effective way, but I believe it's ethical. I think it's the most ethical way. I believe healthcare is a right. It's not a privilege, and I believe healthcare should be provided to all, but it should be equal with the same level of quality for all. And European countries in particular have shown that over the years. And I believe that this nation, if it took the right measures, could achieve an excellent national healthcare system.
Well, I appreciate you meeting with me and talking with me.
My pleasure.
So, thanks.
Thank you.